Welcome to another Unscripted Sessions with myself, Amir Parsa, Managing Director at Parsa Wellness. Today is probably one of my favorite interviews that I'm going to do in my entire career. My guest today is someone I grew up with, someone I had the pleasure of having a lot of fun with during my young years. And today we are sitting as co-workers and we're going to chat about all of his special abilities and all the things that he can do for Parsa Wellness Pain Management Program. Without further ado, I want to introduce my best friend, my brother, Amir Bonyanpour. Thank you so much for coming today. I appreciate you being here with us. I want to dive in and I want to get some background info for the audience to know about what got you interested in chiro, what got you go into that program, and how it all started.
As you know, growing up, I was involved in a lot of different sports, from American football, basketball, to many different types of sports. While playing those sports, I got injured a lot. And as a result, I had to keep seeing different practitioners to get myself back on my feet. One of the practitioners that really helped me back in the days was a chiropractor who dealt with a wide variety of injuries. When I started seeing a chiropractor, I thought it would be only for a back pain or something to do with the spine. But early on, I found out that they deal with way more than just the spine. This guy, again, like playing basketball, I had a lot of arm injuries, shoulder injuries and everything. Playing football, back issues, knee issues. He did it all. So that sparked an interest for me to look into the field of chiropractics. After finishing high school, I went into kinesiology to learn a little bit more about how the human body works. That even furthered my interest in the field of chiropractics. After finishing the kinesiology degree, I decided to move into Portland, Oregon to continue my education in chiropractic field. And a couple of years later, here I am.
When they're gonna come visit you, how your approach is different, how you treat pain differently from conventional methods.
So one thing that I do that I learned from different chiropractors that I shadowed and from the chiropractor who worked on me as a younger athlete was that adjusting alone doesn't do it all. Sometimes in addition to the adjustments, you need muscle work. You need increasing the blood flow to the area. You need different techniques to come together to help a person get better. So that's what I did with my own practice. When a person comes in, after taking the history and understanding their health better, I usually start with muscle work to relax the muscles. When something is bothered, even if it's a joint issue, usually there are other stuff attributing to that issue. So I start with the muscles, relaxing the muscles, and then going into increasing the blood flow to the area, adjusting the affected area that is causing the person harm or hurt. From there, we move on to providing them with proper postural assessments and proper posture, how to fix their posture, as well as giving them exercises to maintain that posture and maintain the strength of the muscles so it prevents further injuries into that person.
And I can speak to that as a first-hand patient of Dr. Bonyanpour. So he is very thorough in his practice to make sure you're getting the best care that's possible. I want to let the audience know what kind of conditions you treat.
Honestly, I've seen it all. Basically, any kind of pain that could happen in your body that could cause you hurt or harm, we can deal with it. As long as it doesn't need a surgery. We don't do any kind of surgeries. I usually categorize people based on their occupations because most of the time what they do in their daily lives affects their issues. So for example, usually people who are computer programmers, dentists or dental hygienists come in with issues with their neck and with their shoulders because that's all they do. During the day, they're putting strain on their neck and shoulders. So they come in, we take care of their upper body muscles, their neck, their shoulders, their arms, as well as reviewing the other parts of their body to make sure everything is okay. If a person is a trace person, they usually have low back issues or knee issues. So we focus on that. As far as common conditions that I see, most of the time it's shoulder issues, headaches, neck pains, and back issues. I've had people with knee and ankle issues, someone who was trying to train for marathon or sun run here. they had issues with their knees, and they wanted to be able to make it to their marathon in the next 3 months.
Right.
So they would come in, we would do the treatment portion as well as the proper exercises to get them ready for the marathon. So we deal with every single bone and muscle and joint in your body.
Head to toe, ladies and gentlemen. Head to toe. Well, let's talk about something fun. Let's talk about when a patient comes to you for the first time. Walk me through that first session. Walk me through what a first visit looks like for anyone that might be watching this and then wants to pick up the phone and call Parsa Wellness to come in.
So the first session, usually they're an hour long, because we need to get a detailed history of what have they been going through in their entire life. From when they started walking, what kind of injuries they've had, until present day. Based on that, I decide what kind of orthopedic testing needs to be done, what kind of neurological testing needs to be done. And off of that, we go into discussing the treatment options. There are many different treatments. Some people, they need the muscle work. We do the muscle work and it takes care of their issue. Some people need more. Other than the muscle work, they need the adjusting or cupping or instrument-assisted techniques to help them gain back their quality of life. For example, some people, they come in, they're scared of getting adjusted. There are many different techniques to deal with their issue without having the adjustment done. I like doing the adjustments, but if you don't like it, I'm not going to force it upon you.
I think it's scary for a lot of people.
It is scary for the people who have had it for the first time, who are having it for the first time. So we start with something lighter. It's called mobilization, which you don't hear the pop, as they say, but it still moves the joint without causing that scare factor. After doing the treatment, we go into talking about their daily lives, how they should adjust their position, the way they move, the way they do stuff during the day to correct the minor stuff that could cause that pain or any other issues to come back.
Right.
So based off of that, I give them exercises to do in their daily lives, as long as hopefully they will do it, and we move forward from there. And we make a plan for them to see how often they need to come see me, how often they need to do their own stuff, their own at-home stuff, and we move forward from there.
You mentioned giving homework or giving exercises for them to do at home. Can you tell me how much of a percentage that will help the patient if they're consistent with these homeworks?
A lot. It changes everything. If you do actually do the homework, it helps. It prevents further injuries. It prevents the same issue that happened to you to come back, to creep up back to you. So it's like I try to convince people. I was one of those bad students who wouldn't listen to my chiro at the beginning until I started listening. And I was like, oh my God, this is changing stuff. This is helping me getting better. This is helping me going through the pain of having to drive to the chiro and having to go through the treatments. I kept on going for the maintenance afterwards, but I never had to deal with the major pains that I started seeing the chiro at the beginning. So it definitely changes things.
Goes a long way. Being a one-stop pain management clinic at Parsa Wellness, we want to see how this team kind of flows together and works together to get a patient from point A to point Z. Can you talk about how chiropractics helps complement the other holistic approaches that we have towards pain? For example, being osteopathy, massage, acupuncture, and physiotherapy. I want to see how these things connect together.
Oh, they complement each other perfect. As a chiro, again, like I work with the muscles and everything, specific areas to help it heal. Some areas they need more work. For example, when I work on the muscle, I help it relax a little bit, but it needs further more work. That's when I ask people to see a physiotherapist or acupuncturist, especially for the needling portion, for example. The needles can get some areas that my fingers can't, my hands can't, and it could help further the treatment. So the pain would go away and never come back. So they all go hand in hand. Massage therapists, for example. I do some muscle work, but massage therapists, they have their own arts and crafts. They know what exactly they're doing with the muscles, so they can further the treatment, help the person get rid of their discomfort or their pain in the future. So they all work hand in hand.
Yeah, and that's one of the things I want you guys to really focus on, the fact that all these things together take you to a pain-free life, or at least coping with a pain-free life. We want to be able to be a one-stop shop, to be able to help you in all aspects, not just in one aspect. And some things that might be done perfectly through chiropractics, other things might be done perfectly through another intervention. So these things being able to complement each other is a huge benefit. And working alongside each other is also a huge benefit. With every single vision of medical practice, there are misconceptions. Now, I'm sure chiro has some of its own. So I want to know what are some misconceptions that you can tell us about, so then we can not look at that stereotype, move away from it, and actually start trusting this kind of practice.
This is actually one of my favorite topics to talk about. Yeah. I'm gonna get to the big one that we always see on the social media and the news, hearing it from the friends. Chiropractic care will give you stroke or heart attack or break your bones.
Yeah.
It's one of the biggest misconceptions that happens when the name of chiropractic field comes up.
I get you.
I mean, even when I wanted to apply for chiropractic school, that's what I heard from the people, from doctors even, that, chiropractors, they break your neck, they cause strokes. The reason this whole thing came up is because I'll take you back to the initial appointment, that when we talked about how the initial appointment works.
Yeah.
I talked about taking history, right?
Yeah.
Yes, adjustments could cause harm if you do not take proper history. Mm-hmm. If someone has issues with their heart, they have heart issues, they have cancers, they are having osteoporosis, you should not be adjusting them. Mm-hmm. You should use cellular skills, cellular manipulations. That's when the mobilization comes. If a person is a long-time smoker, you do not want to adjust their neck. You don't want to give them that VLA or high velocity, low amplitude thrust. Mm-hmm. You don't want to do that. What we do instead, we work on their muscles. We do the mobilization to prevent stroke or the breaking of the bone to happen. That's one of the biggest misconceptions, that if you go to a chiropractor, they're going to break your neck, they're going to cause stroke. No, if the chiropractor does it properly, and if you're being honest with your chiropractor and the chiropractor is being thorough with your history taking, that is not going to happen. Another misconception that comes up a lot is that the chiropractors are the back doctors. They only deal with the spine. That's another thing that chiropractors has been misrepresented about. Chiropractors deal with a lot of different type of injuries. As I said earlier, they go from head to toe. Any issues that you have, they can deal with. Whether it's a muscular issue, whether it's a joint issue, bone issue, headaches, we deal with all of it.
One of the things that was interesting that chiropractors work on is dropping. With TMJ, yeah. So TMJ being everyone automatically thinks, okay, I need either injections, I need Botox in it, but chiropractics does a lot of different things for TMJ. So if you are suffering from TMJ, look us up. We have a lot of different articles and material that you can look into, and then also come see Dr. Bonyanpour and talk to him about your TMJ pain. How easy it is for you to be able to book and come in for a chiro session with Dr. Bonyanpour at Parsa Wellness. Most third-party insurances cover chiropractics, and very easy to get coverage for you to be able to just come in and use the insurance that you have available. If you have any questions regarding that, you can call one of our front-end staff will be able to help you out and walk you through what the process is. And for term pain in the Proverb program patients, we already have different stuff available for you that you can take advantage of. With all that being said, I do thank you for being here with me today. It was actually a great pleasure and great fun for me to have this session. You'll see both of us a lot probably. We'll sit down and have a chat and talk about more detailed practices that Dr. Bonyanpour has in his practice. And we look forward to seeing every single one of you at Parsa Wellness. With that being said, have a wonderful rest of your week.